Can I start with flutracking.net, your inspiration in starting this many years ago, and tell me how many people use it and how effective is it?
Yeah, so look, we started in 2006. In 2005, I read an article called "Did You Have the Flu Last Week?" It was about a phone survey of 1,500 people in Sweden trying to get 1 week snapshot of flu symptoms. And I thought, gosh, there's this internet thing now, which would probably make that a lot more efficient. So in 2006, we launched with 400 people. And it's grown each year, particularly during the 2009 influenza pandemic when it was quite useful. We had about 8,000 people then. But last week, we had 150,000 people across Australia and New Zealand respond to our surveys.
Well, that is fantastic. So let me say it again, flutracking.net. And I wonder, Craig, whether this is going to be a way of the future. And I read with interest a stat that I'd like you to comment on, that as of this time last year, there were 16,000 flu cases. We've had 99, I believe, in Australia so far. What do you make of those numbers?
Yeah, look, the last time I looked at the flu stats in terms of laboratory data, they were about half through February. So I think they have dropped quite dramatically. There's a couple of reasons for that. One is we think the social distancing is working really well. So all respiratory symptoms are decreased because a lot of the bugs just aren't transmitting between people so much, which is great. And also, a lot of the testing has shifted towards COVID-19 rather than flu. So they're actually testing less for influenza this year.
And Craig, we're hearing the government talk about an app that they are encouraging Australians to sign up to. And it's, I suppose, in the vein that you have been for over a decade. And can you talk us through that model and whether you're a supporter of it?
What it basically does, it's a proximity detector. So it just logs your proximity to other people that come within, say, a 2 metre or 1.5 metre range, and logs the mobile phone numbers of those, so that if you go back and need to see who you've been near, you can go, the app can be downloaded, the data can be released, and those people can be telephoned. So it could be a good prompt. Obviously, there are privacy concerns that some people are raising. Probably the location tracking that's already happening on your phone is probably more of a privacy concern than this is, but it's for each individual to make up their own mind. Our app is quite different with flu tracking. We're just reporting on cough and symptoms. People do give their postcode when they join, and then we look at the number of people who have cough and fever in each area, and people can, when they join, they get a report each week. They can go onto our map and look at their local postcode and see the flutracking.net participants around them and how many have cough and fever.
Craig, do you see as a way forward in the future, if these things inevitably continue, that we get to a point where we wake up, we brush our teeth, we have a glass of water, have our cup of tea, and we jump on and we let the world know exactly how we're tracking in terms of this? Is that a potential in the future?
Yeah, I think it is. Like we've got 150,000 people doing it now. It's like 1 in every 66 people in New Zealand are doing it. So it's getting popular. And I think the secret is taking no longer than about 10 seconds. People are happy to give 10 seconds for the health of their community, for research, but it's got to be short and sharp. Other than that, we're going to rely on data that's just captured automatically. Perhaps it'll be monitoring fever and smart thermometers, or even on our phones, our smartphones and smartwatches.
And Craig, do you see part of flutracking.net and any other app as a solution for us to come out of the lockdown scenario more effectively, where if you can pinpoint it to a little part in Newcastle where you're sitting right now and you say, OK, let's put a specialist team in there rather than shut down the whole of New South Wales? Is that a solution?
It could help with geographically focusing on a particular hotspot and getting the people in that area to decrease their mixing and increase social distancing. It could work like that. The other thing it can do is that the flu tracking data kind of dropped down very quickly before or as the lockdowns came in, as people socially distanced. And so we expect it will rise ahead of COVID as well. So if we see flutracking.net data rising, that's probably a warning that COVID is on the way, that we've got conditions that might be conducive to spread. So it might help us gauge how well we're doing with our social distancing.